Good people. It's happy Sunday. Happy Sunday. Happy Sunday. Happy Sunday. Trying to make sure. I don't know if we live yet. Just making sure we're waiting on this live coming to pop up. Happy Sunday, everyone. Tough one today. Tough one today. It's really tough. Tough for the basketball community. And man, my heart goes out to the Keegan family and everybody's. It's not what we expected. Not what we hoped for. Um, it's tough one. Tough one. Man, we lost a young guy who had so much to looking forward to. Keegan and all the family. May you please have peace and strength during these trying times. Man, Keegan, rest in peace, man. God has acquired a point guard, man. Yeah, rest in peace, brother. But today, we had a great program scheduled today. We're going to be talking to Kenyan physiotherapist. Yeah, with no further ado, I will bring on here my man Martin
Hey,
Ongwen. How you doing, sir?
I'm doing great. Thanks for having me. Thanks for bringing me on up here. I appreciate that.
And this has been a watch for a long time. I know we've spoken for a while, maybe over the last 2 years, man. You know, we've bounced things back and forth with you.
Yeah.
And we'll do some. We'll do some. You'll be one of my camps when we come and do we'll be over there. We'll bring you in and so you can show us what you do, man. But right off the back, man, let's talk about physiotherapy and let's talk about your background a little bit and just give people a little background of yourself, man. When we talk about physiotherapists, a lot of us get scared when we hear that name, physiotherapy, especially sportsmen. When you hear something about therapy, that says you're not going to be playing.
Yeah. Yeah, I guess that's what a lot of people think, but I think people should be really excited when they hear about physio and or therapy, because ideally we could look at it as an avenue to fast track either our return to sport or return to play after an injury, and or injury prevention. So yeah, what's physiotherapy and what's my background in physiotherapy? It started out. My mom is a physiotherapist, so like mother, like son, I would say.
Yes, yes, yes.
Yeah, so I ideally wanted to become a neurosurgeon growing up, and that was like my passion. So didn't make the cutoff points to get into med school. So I was like thinking, which is the next best thing or the closest thing that I can do to get me into the medical field. So I thought, let's try physiotherapy. So I did go to.
I lost you for a second.
Can you hear me now?
Yeah, I can hear you.
Yeah. So I did went through training in the Kenya Medical Training College, and did my diploma in physiotherapy, and did my higher diploma in orthopedic manual therapy. So it's an advanced form of physiotherapy, like a specialty training, and also cardiac rehab and neuro rehab. So those are a lot more medical rather than the sports rehab training. But I've also had a background in sports rehab and strength and conditioning training as well. So a
Yes,
lot of
yes, 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 yes.
a lot
So,
of
but Why did you get into it? Why did you get into it? And the Kenyan market, the way we know sports,
Yeah.
the way we see sports, our approach to sports, we're not even a place where we can put physio guys on the team, even though we should have a physio guy. We are not even there yet. Why did you think of getting into that avenue despite knowing all the, all the hindrances and everything blocking you to get to, even to get a job or even to work on a team?
It's the love and the passion for the profession, bro. It's I guess despite the difficulties we've had in the profession, there's been a push towards the right direction, one way or another. So also it is difficult to get, considering the finances. A lot of the teams in Kenya and sports is not considered something that you can really live off of or make money
Yes,
out of, because
yes,
considering the background, whether it's football, whether it's basketball, whether it's table tennis, whether it's any form of sport, it's not given the hype, I would say, as in the US or in Europe, as something that you can do from a very professional level. So I can remember even in school, I played basketball, so I have a basketball background as well. Just got into med school, got busy, and left it for my younger bro, Franco Gallo, who plays
yeah.
for KCA. So
Okay, okay.
yeah, so still that drive and the passion to try and push the profession forwards and try and fill in those gaps, because I believe that these are gaps that can be filled by, number one, education, running podcasts like this one so that people can actually really understand what it is that we do as physiotherapists. So it's still a hustle to try and explain to people why they need, number one, a medical doctor in the team, a physiotherapist in the team, a strength and conditioning coach on the team, a sports psychologist.
Yeah,
We
yeah,
we don't. Those are, those conversations are non-existent. All right,
yes,
but I believe that us young people can be the drive to change that conversation, or we can be the people to introduce that and probably take sport from just being something recreational to something that can be
I guess someone calling you, man.
yeah. So yeah, somebody's calling me. So
No,
some
he's all good.
yep. So taking sport from just being a recreational thing that we do on our time off when we are less busy, and making it something that we want to be passionate about. So I consider sport not just as something recreational. Since I'm in the health field, I consider sport as a prevention tool for non-communicable diseases, a prevention tool for mental health disorders,
Yes,
a
yeah,
prevention tool for the youth getting into drug abuse, because sports brings people together. Sports also kind of instill a certain form of discipline, because I can tell you for free, I finished school because I was playing basketball.
yeah,
That
yeah.
just that
A lot of people did. I'm one of those people.
if it
I'm one of
wasn't
those
for
people.
if it wasn't for sport, we will be in other
Yeah,
places doing other
yeah,
things,
yeah,
right?
yeah,
Yeah. So I still have the passion to bring in the element of physiotherapists and other medical professionals within the sports space. At least we can say that in the medical profession, we've had a big number of surgeons getting or thinking about getting into sports. Like there are sports surgeons in the US, the sports
yeah,
surgeons in Europe, Asia. So there's a very good structure in relation to having medical professionals work in conjunction with coaches, fitness trainers, strength and conditioning coaches as well. So
yeah. But it's so for all those people to work together. there's some synergy kind of. It has to work together. It has the trainer has to be aware of what the strength and conditioning training coach is doing. The doctor needs to know this player. This is what I've been doing. But let's look at our structure in Kenya, the way sports is structured.
Yeah.
How do we get there? How do we move now to having the fitness people, the strength and conditioning, how do we get to that place? Where do we start? Like, where do we start? Like, for example, to bring a physio on board, how do we go about getting a physiotherapist on my team? Let's say I'm out there looking, like, how do you get there?
Um, can I throw the ball back at you?
Yes,
I would say education. I would say if I can manage to bring in all the different coaches we've had in the basketball space, if I could bring in the leadership, the basketball federation leadership, have them sit in a room and explain to them the importance. Like, I have research to back all the things that I'm probably going to talk about on, in terms of injury prevention. What are, the numbers of injuries that we have in the basketball, in the NBA in itself.
yes,
And we can use that research to follow, or to convince the key players in the basketball federation to introduce, or kind of like form or have a setup where we have a coach who's, well trained. Most of the coaches are well trained. They played basketball, and through that they built up, or rather came from playing basketball into becoming coaches. So they have that background in there. So if we can convince them to, we need a physiotherapist who has an understanding around how is basketball played, what are the injuries in basketball, and how can they, number one, prevent those injuries from happening. Basketball is a contact sport, right? So we
yes,
cannot say that we are preventing injuries 100%. We can't confidently say that, but we can prevent players from, there's so many young people out there who had an injury of some sort that could have been well treated
yes,
so that they get to a professional level. But some of us had to, kind of like drop out of playing basketball because of an ankle sprain. All right,
yes.
an ankle sprain,
Unfortunately,
yeah, and they can be treated, or some knee surgery, an ACL surgery, with no proper treatment and or follow up. All right, so if we can get education, education is pretty much the starting point. We get all the key stakeholders in the sports area, have them sit in a room and show them that, hey, this is what sports physiotherapists do. This is what a sports surgeon does. This is what a sports psychologist does. And if we bring these people together, have them make decisions for the team in a collaborative manner, all right, then we
yes,
will have we will have, number one, your players will be performing at 100%, efficiency, all right. And
yes,
even if they're not performing at 100% efficiency, it's about 90, or rather, the least is 80, if they have an all-rounded team of specialists that are taking care of them. All right. So get let me have you do the work of getting these people in a room. Call me when they're in that room, and then we can start convincing them. I'll come with a team of physios. I'll come with a team of sports psychologists who we have in Kenya. There are few, but
yeah,
the number is starting to grow, which is something impressive. Sports management people, people who
yeah,
studied sport management, and
yeah,
let's put enough money into it. We can't have this conversation without funding for that process, because
yeah,
all these people got to get paid at some point, right?
yes,
So if we can channel the right funding in our sports associations, or rather in basketball in itself, then we will have an all-rounded team. And I can tell you for a fact that that is what is going to change how people view sports, and that is what is going to change or put Kenya into the international basketball market. And you can look at the figures. LeBron James you spends up to a million USD in physiotherapy alone.
Yeah, that's taking care of himself, man. That's no wonder he's playing. He's 36, man, and he's still playing at a high
Yeah,
level. You know, he's 36, and
yeah,
But again, as you mentioned, you brought a good point, man. Funding has always been, so the way a lot of teams operate in Kenya is I will look at my funding and I will see, okay, there's players, there's coach, there's physio guy here, there's a trainer here. And we go and we're like, man, we don't need that physio guy. Man, we don't need that train. You know what I mean? That's the way we what's the most important person? Our coach. Coach like Kibizawatu, coach knows a little bit of so that mindset, that mindset, that's what I'm talking about. Like, how do we that mind I know the education is there, but at the end of the day, we are looking at the flip side of that is the dollar amount, like the funding, the money you're talking about, you know. And from a lot of perspective, it's like bringing physio guys a very expensive process, you know, because you guys have gone to school for a longer time, all that plays in people's minds. So it's kind of like, how do we get these people even to approach you and talk to you?
yeah. I guess we do a lot of pro bono work, and I won't say I mind doing pro bono work. We can do pro bono work to kind of like give them an idea, or rather
Of
show
what you
them
do. Yes,
what we can do as
yes,
physiotherapists. All right. The problem with doing pro bono work is people usually feel that this is something that should be free. All right. And
yeah, yeah. Or you don't expect a payment even in the near future.
yeah. And an experience with pro bono work in Kenya that we've done, even from training physiotherapists, like providing continuous advanced medical education for physios who want to participate, or rather be sports physios.
Yeah,
They feel that they shouldn't pay for any form of advanced education. All right.
yes,
So
yes,
so what we do, or what we have always done in the over the years, is provide some sort of free training and ask them, do you feel that this is something you pay for? And I don't refute that, or I don't refuse that. It is expensive. It gets expensive to have all these professionals within the sports field, or within the
yes,
sports space.
yes,
But I think with structure, if getting to the Ministry of Sports has been chaotic. Trying to reach. Let me give an example of the Football Federation has been chaotic. Trying to get to the basketball stakeholders has been chaotic. So that mindset can be changed by having, we can show them, and we can have players come on stage with their stories of,
yes,
hey, I had to drop out of this because I had an injury. And if we look at the statistics, this injury would have been fixed,
yes,
you know, much
yes,
quicker, in a less expensive manner. Because ideally, you have a lot of people who have a problem that is solvable, but they have no idea. They go to a general medical doctor, or
yes,
a generalist, physiotherapist, or psychologist, who's not does not have an idea what it is to be a sportsman, or rather
yes,
does not have a training in and around, or the background behind being a sportsman. So that makes it, players go in cycles. And players have been to physiotherapists who have stopped them from playing because they had an ankle injury, which the physiotherapist did not have an understanding of addressing. So what
okay,
is the next best thing to do for your player? Stop them from playing. All right.
yes, yeah,
Yet, but we've also had people, you have the best player. I was not trying to be a show off, but I was a guard in my school, in Rapogi High School. I was one of the best guards. Ideally, I myself and a few other guys from Nairobi who had an idea of how to play basketball. We coached ourselves, to recruited other people and started coaching them to try and play basketball. All right. So if you look at, let me give an example of LeBron James. He's a high caliber player, right? So what
Yes.
is the if the coach feels that LeBron cannot be on that pitch, then that's a problem. So LeBron has got an injury. He has got an ankle sprain. Let me give an example. He has got an ankle sprain or some inflammation in the tendon, in his Achilles tendon. But the coach feels you need to keep pushing. You need to still be in that court for the rest of the team to, that moral support. All right. But the coach doesn't understand. The more he plays this guy, the more the injury in the tendon becomes worse. So as time goes by, you find an athlete who gets a torn Achilles tendon just because he was not rested and just because he did not get the right treatment. So you have that at the end of the day you end up losing it all. All right. So
Yeah.
your player needs to go in for surgery. It takes way much longer time for people to recover from surgery. It takes a longer time for even them to get back to sport after surgery. All right. But with the right approach, we can have these players perform at optimum. They have very few injuries, and that is saving money, right? If you you know
It is. It is.
if
Treatment is expensive.
yeah, so if these people have an idea of how much money they can save from general surgeries for athletes, because going in for a surgery can cost up to 800, 800,000, 200,000, 500,000. So it's six figures at the end of the day, right? Whether it's a minor surgery, a lot of people call it minor surgery, but if you look at the costs, the
It's not
costs
minor.
they're not minor costs, right? The procedure
No,
is minor,
no, no, no,
but
no.
the
So
costs are huge.
yeah. So let me ask you a question.
Yes.
So I'm a player. I get injured. What should be my next step? Like I got injured now. I don't have a physio on the team. We don't have we don't have a doctor. We don't I get injured in practice. What are the next steps? What should the players do right now? You're helping the players who get injured in practice. What's the next move they should do?
Number one, you get injured is you players need to take care of themselves. Because at the end of the day, if you look at how the sports system in Kenya looks like, if you get injured as a player, you're a disposable agent.
Yes.
All right, you like they
Eumia.
don't. We are I share.
Aishie. Kuna injured.
We are gonna injured. Okay, bench. All right.
Yeah, yeah,
So if you get injured as a player, inform the coach. Tell the coach that hey, whatever happened in that court, in the court, did not feel right. All right. So of course, there's first aid. There's the immediate first aid that's usually at the pitch, right? So the first aid guy will do a quick assessment, and first aid does need to be trained. So if you look at how the NBA is structured, they have like an orthopedic surgeon actually, or they have somebody in orthopedics who's highly trained. They're the people who assess when an injury or how an injury looks like. If you have a torn ACL, there are certain tests that you can do within the pitch to identify that this is a torn ACL,
yeah,
and that can be done in court even before you get to hospital. So that is picked up early. All right. So if the first aider has an understanding of how to do this test or how to determine whether somebody has had a concussion, for example, because there are certain procedures that need to be followed after an injury. So the player number one informs the coach. Of course, depending on the injury, if everybody saw what happened, there's an element. If it's an ankle sprain, it looks like a just a normal ankle sprain. Of course, there are those injuries that you can continue playing with because it's a bruise and nothing major has happened. Then there are those injuries that need to be assessed. So there are injuries that are dangerous, a little bit dangerous. Then you need to get out and be assessed immediately after. Now, if you've had an injury and you can continue playing, all right, you need to also assess whether is this injury making me be less efficient as a player or is it something that will go away? because okay, the body has got an inherent ability to protect itself from any form of danger, right? And it also has an inherent ability to heal itself. So if it's something that you don't need help with, yeah, it's you can that can go away, all right? But but an injury, anytime you get an injury, have it assessed by either a medical doctor or a physiotherapist. All right. I would advise that it be a sports physiotherapist or a medical doctor who has a passion or a love or some love for sport, right? Because
Yes.
then there or some sort of musculoskeletal training. Because then and only then do they have the ability to direct you to or fast track your treatment. So the player takes care of himself, informs the coach that the injury that they had is significant enough to stop them from, doing high intensity stuff. So they need to be rested. So you can rest. I'm not saying that you get off the court and take like a 2 weeks or 3 weeks hiatus, but you you rest so that you assess the injury. If the injury is not that traumatic and you can still play, then I'll advise that you continue playing. But if the injury is stopping you and you feel like you're being less efficient, let somebody else play. No matter how, whether you're the one carrying the team, Kawendo Pro team, Wendo Nabeba team, get let somebody else shine for for a few minutes. Because I've experienced players who, despite having an injury, they brush it off, and that happens a lot with athletes.
Yes.
Athletes usually feel that they need to keep pushing. All right, I need to keep, I need to still push. I need to still
Yeah.
push, but they don't understand that by keeping or by continuing to push, they are exposing themselves to a lot more harm than good. So those are the steps that they can take.
So so how do I discern or like okay, I'm looking for a physiotherapist. I've got injured and I'm looking online and for physiotherapists, they say physiotherapist. How do I even know if that person is a physio? They even know what they're talking about. Like, what do I like? If I'm going to the office, what am I looking for as a player? Or if a team, what are we looking for? Like, how do we cross-reference and make sure like this is possible? Like, for example, it's different when someone knows what you've been doing. But
Yeah.
like, is there like a place where we have that physiotherapist, like a hospital location, where they are located, where we can just go and that's what they do?
So there are a few. I've seen a couple of sports physiotherapists around, and they have their clinics, and they specify that this is a sports physiotherapy clinic. But also, I'll say if you look at the major hospitals in Kenya, they do have a physiotherapy department. And if you
Okay,
look at the procedure for seeing a physiotherapy department or for seeing a physiotherapist in Kenya is still you need to see a doctor first for you to get a referral.
you need the
And
referral. Okay, yes, that's
yeah,
what. Okay,
yeah. But if you're educated, a lot of the advanced or educated people just do a self referral because they understand that they need a physiotherapist. They know where to get this physiotherapist from.
yes,
There, there are some who are online. I will say look for a clinic and ask the physio. Do you have some experience in doing sports therapy, or
okay,
if do you have an experience in sports physio? Then you'll get directed towards the right direction. But as we speak now, there is no clear pathway of I get an injury, I'm a player, I'll find a physiotherapist here.
no,
You know,
no,
some uh, some of us talk about what we do. Rarely, of course, in the medical field, you find very few people advertising themselves on social media or educating
yeah,
people on that, and that's
yeah.
also a downfall. I think we should have a physiotherapy podcast where we talk about such things, right? And that's in the pipeline. We'll talk
Yeah,
about
no,
that.
it's important. Even for me, like I know I talked to you one time, and I was like, man, like, and then you send me your resume, and I'm looking, I'm going like, wow, he's done all this. Like, how? I mean, I've been in sports, man, for a long time. How don't I even know you? Like, what I mean? Like, I was taken aback. I'm like, man, that's a great asset. For example, like we have Eugene, Dr. Eugene,
Yeah,
and everybody knows Doc because if
yeah,
something happens, everybody runs to Doc. What I mean? It doesn't matter in Homa, any
yeah,
kind of something happens to a basketball player, the coach on that team is calling Doc. So everybody knows Doc. So that's why I was like, man, this is a great resource to have, and people to get to know you, so we can use your experience, or you can help guide people. Because we had a interview 2 weeks ago, a guy named
yeah,
Sila. He had a
yeah,
hip injury, you know, and he goes from it just being a small hip surgery to he's not playing no more. He can't walk now. And then, he finally gets the right doctor. Again, Doc Eugene, shout out to Doc. And Doc Eugene really understands sports and understands, you know, the body. So he was able to help see that. But the injury should have not been big in the first place. It was a hip injury, should have gotten treatment, and he's back, but he ended up losing 3 years. But real fast, I got a question here. Someone asked here.
yeah.
Um, I'm gonna post it on here for you to read.
Alafu can slip disc from the spinal cord that is approximately 1.7 years be restored back to position, and what's the remedy for degenerating bone, the lower back? So yeah, let's talk about slip discs.
Yeah,
There's certain
that's a big
medical.
one. That's a big one. That's a big one.
I would say it depends. It depends on the level of the injury. All right.
Yeah,
And usually discs don't slip. Like there's certain medical language that is out there that is usually very scary for a lot of people. So the human spine is robust. Like it's designed to take a lot of forces on a day-to-day basis. All right.
yes. Mm,
Now, when a disc is, when a kind of like a disc is slipped and there's a disc bulge, or there's an injury within the disc in itself, a lot of times it usually heals. If it doesn't heal, or if it's there are certain things that we tend to look at. Number one is it a bulge, and do we have any form of nerve pathology in there, or nerve injury in there? If there's no nerve injury, if there's no pain going down the leg, if there's no symptoms of numbness, tingling sensation, a loss of sensation in the lower limbs, then that's something that can be dealt with. All right. And
yes.
you cannot, the only best way to stop aging is exercise and physical activity. You can't necessarily stop it, but you can delay it. All right.
Yes.
You can delay aging, and by delaying aging, I mean, um, you can delay how your body degrades over time. So you're still strong, you're aging, but the capacity, the strength that you have in a human body is maintained by, number one, playing basketball. You keep playing basketball if you need to. There are certain exercises that can be done to target the structures around the back that are causing your pain. And
Yes.
sometimes it's not necessarily those structures that are causing the pain that you feel. So even if you go for an MRI, before I send you for an MRI, before I send you for an X-ray, I need to do a proper physical examination that determines the next best steps to take as a medical professional. And yeah, let me put Doc Eugene on the spot here a little bit. Referrals. All right. So
Referrals
so
to doc.
yeah.
Yeah,
So
yeah, yeah,
if
yeah.
you get a sports guy or an athlete come to you with some sort of injury, all right, you it is your duty as a healthcare provider to find who is the next best person who can help this person. So if let's say I was at the pitch, or if you come to the clinic with an injury, and they do a physical examination and they see that it's an ACL tear, the next best thing that we can take the rehabilitative way, or we can say, for you to get back to sport, you will need surgery. So I'll prepare you for surgery. I'll give you a program that we do before surgery, so that when you get to surgery, the detrimental effects of, because surgery is like incision, creating an incision, you're damaging the body so that it repairs itself again.
Yes.
So we prepare you for surgery, and after surgery, we help fast track that treatment. So a patient who has had physio before surgery has got a lot more better outcomes after surgery. All right. So their return to sport is fast tracked. They get back to sport really quickly. So referrals are important, but when it comes to the slip disc, let's do an assessment. We see if if you have any signs and symptoms that warrant further screening, we'll send you down the right path. But if we do not find any significant physical findings that are kind of like showing us we need to see a specialist for this condition, then we can help you with that. Back pain
Actually,
should not
she's saying actually it was detected after the MRI, but again,
all right.
yeah.
The human body has got the ability to heal itself. All right. So we have NBA players. If we put, let me say, if I put 30% of NBA players who are above the age of 25, they'll have a slip disc. The MRI will show that they have a slip disc. All right.
Right.
Where you're sitting there, you have a slip disc. As in, but that is medical language that right now we are trying to move away from. Because if you look at your MRI and you see a slip disc, what is the next thing that you're starting to think as a patient? Oh my God, I am damaged, right?
Yeah, 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 yeah.
Yeah, yeah,
I can't walk no more.
yes. So, but that is not necessarily the case. It is how that information is presented to you, and this is something that we try and train medical practitioners to use the right words and do a proper physical examination to determine whether your patient is going to need further triaging or rather specialized treatment. If not, if it's something that can be addressed, yeah, see a physiotherapist. They'll design a treatment package for you, a proper treatment package,
Yeah.
and a rehabilitation pathway that suits you as an individual. And these are things that you can heal from, and you can still get back to playing sport. All right. So let them come over. We have a look at the
Mm.
MRI again, but
Yeah,
they'll heal.
yeah,
Yeah.
we'll share your contacts. We'll share your contacts. We'll start doing that and really pushing that. But so let's talk about common basketball injuries, man, because that's basketball. There's those injuries we happen every day.
Yeah.
Hamstrings, jammed fingers, ankle injury, ankle sprains, and the knee. Those
Yeah.
happen almost every day. Concussion does happen, but it's not detected that at a very high rate. But those four things. So
Yeah.
let's talk. Let's go like a finger jam. Like players get a finger jam, and we just pull it. Or what should
Yeah.
we do? I get a finger jam, then what? I get a finger jam.
Sausage finger.
Yeah, I get a sausage finger. Yeah, I get a sausage finger. It may jam. Until even my fingers cannot be straight because they are most of them jammed anyway. So
All right. I can give a rundown of what are some of the injuries, the major injuries that happen in basketball. Number one is ankle. The ankle is has the highest percentage of injuries, and they up to 11.6% in terms of injury. All right. So the
yeah,
ankle is usually the number one priority in the NBA to address. So let us address the ankle injuries
yeah,
now. In according to your question, if you get a jammed finger, the next best thing is, do you have structures within the finger that have been damaged. If not, the body has the body needs to take care of itself. So after an injury, you have the inflammation process that takes place. So there's the swelling, it swells, it gets big, and then it becomes painful. So that pain in itself is information that there's actually some sort of tissue damage. So if we don't have any structures that are injured that needs repair, what we can do is, rest it, or try to restrict motion at the beginning of the injury. But what we want also, we don't want to stop using that finger. We want to, all right, we
Yeah,
want to,
yeah.
we want to, in a way, protect it. So sometimes, just tying these two fingers together so that this doesn't really move much, but also,
Body system, man. You gotta use that
yeah,
body system.
yeah, yeah, yeah. So you can ice it. Wiggle it around. Just you do gentle range of motion exercises until gets back to normal. All right. If there's any form of ligamentous injury, there are splints that are usually used, to treat any injuries within the hand in itself and the fingers. All right.
Yes,
So rest. Ice it, reduce the inflammation process, and ice is a very good uh, go-to, immediate go-to for reducing inflammation in the areas. There are different products out there like biofreeze that you can use as well to reduce inflammation. But tying as well, that has usually been the standard procedure for treating a sprained finger. So yeah, those are some of the things that you can do,
I know you
unless,
started. It's broken.
yeah, unless it's broken.
Yeah,
Yeah.
and I didn't mean to cut this, but I know you started talking about injuries and you started naming them. So just go ahead. You talked about ankle being the number one. And what
Yeah.
else? What else? What else should players be aware in basketball when you're playing basketball? This is what might happen to you. Because I think if you're aware of it and it happens, you have more knowledge. You can identify is it was or not, or you're aware of what's going on.
Yeah, so we have ankle sprains as not the number one problem for basketball players. It's usually recurrent. Ankle sprains are usually highly recurrent, and a lot
Yes.
of if you look at a lot of the training, and there are a lot of training prevention strategies that we can use to prevent ankle injuries. Number two on the list is the lumbar spine, of course, and we just had a question in and
Yeah.
around the lumbar spine.
Hata kuna mtu amesema hapo watu wabaki kuna mgongo na uma deadly.
Yeah, and that can be prevented, and I can talk about some of the like simple steps that you can use to prevent some of these injuries. So the lumbar spine shows that it has got the second highest percentage in terms of how basketball players present in the clinic. And then we have the patella, the knee. Then we come to
Knee.
the patella in itself. So the patella is that
Yes.
small small bone that runs up and down sideways on the knee.
Mhm.
That also has got like a high percentage in terms of injuries. And then we have the foot and ankle. All right, and then we have the tibia, which is one of the bones that form from the knee to your ankle. And then we have the femur also usually has different problems that present in itself. So the hip, and then the hand, and then we have the face as well. So of course,
Yes. Yes. Yeah.
there's
But
there's
the
a,
elbow.
there's a patella anytime somebody's fingers in your eyes. A
Yes.
lot of shoulder problems present there, but all of these injuries can be presented that can be prevented, and they have a rehabilitation protocol. Most of the injuries in basketball have a rehabilitation protocol.
Yes.
Whether it's a fracture, there are certain protocols that will be followed to be able to address those injuries. All right. So the least, is injuries to the cervical spine. There's very few percentages of concussion in basketball. Actually, a
Yeah.
lot of the concussions happen in rugby. So those are just some of the injuries that you tend to see in basketball. And the injuries that happen in basketball are, number one, overuse injuries a lot of the time. All right. So an athlete doing, you like you're the top athlete in a particular team. So there is no time your coach is resting you. All right. You're always playing. You're always playing.
Load
All right.
management.
Yeah.
Yeah.
So either you did something a little too soon, too quickly. All right. Because some of those injuries happen that way. And overuse injuries are a lot more common than injuries that happen, contact injuries or trauma. All right. So those are the most common injuries that happen. I'm seeing my phone battery is getting on the low there. I may have to real quick.
You
Yeah,
good?
but those are. Can you hear me still?
Yeah, I can hear you.
Yeah, sorry about the echo. It'll be on for some time, but
No, it's fine, man. We're sharing
yeah,
some knowledge here. We're sharing knowledge here. Think-
yeah. So overuse injuries can be prevented by, of course, you need to rest as an athlete. There's this notion that athletes don't need to rest. I need to be at my A game every other time, right? But
yeah,
rest and recovery is very key for ultimate performance. All right.
yeah.
So those are some. That is how some of those injuries happen.
Man, you see, you came on here. You came here on the right time. People are here got questions for you.
Yeah, I can see that. Do shin splints ever go away? I developed mine at some point. They were so painful. Then they just stopped, but the bulges are still there. Can they recur? Well, shin splints.
Yeah,
It is
basketball
painful.
player. I think for him, I think it's overused. Also, he put in some miles.
Yeah. If
Yeah,
so if you look at karate players, they have they suffer most of the shin splints because there's that element of being
impact.
hit all the time on the shin,
Yes,
right? And it's painful because it's there is not so much um skin and muscle to cover that space, right? So it's
yeah,
any injury to the shin, it's directly to the bone, and that is painful, right? It's super painful. But the more injuries you get on there, what the body does is when that bone gets heated all the time, so every time it's get a bit it gets a beating, it has to heal and remodel. So it hardens, and the best way it hardens is by forming small calluses. They're called callus. It's like forming a small extra
calcification.
bone. Yeah, so that
Yeah,
it heals.
yeah,
Sometimes uh, those formations, the body ends up just kind of like clearing them because it's extra tissue. But sometimes they heal that way and it remains that way. All right. So it's it's um uh, it's kind of like, I would say, it's necessary deformity. That's what I can say, or that's what I can call it. So
zivai
and
short
then
ziko.
yeah,
Azivai short akuja mama track.
I'm a long.
Vai longi.
Yeah, but they go away. That pain can be managed. So pain, any pain that players experience is very manageable. But also, pain is information, telling you to either slow down or seek medical attention.
Yeah, and like so. A real quick story, real fast. So when I left Kenya, I had bad tendonitis, like very bad tendonitis. My knees would bother me all the time. But when I go to the States, I used to ice them every day and heat them up. And then within maybe a period of 4 or 5 months, all the pain went away. And that's something maybe we should also start thinking about, like after practice, ice down, like because we don't do enough of that. We don't do enough of that. But like those are some steps we can really help ourselves. I
Yeah.
think. Or what's your opinion on icing and heating up? Using hot pads and ice downs and using cold water after practices.
Yeah. All of that is, kind of like a step in terms of reducing the inflammation that is within the system. Because every time you exercise and or do a sport, it is a lot more work to the body than just not doing normal you know um, uh, exercise to keep fit, right?
Yes.
So icing, or even ice baths, I've seen a lot of the international players tend to use ice baths afterwards.
Yeah.
All it does is kind of like cool down the system, or rather reduce the inflammation process that goes on there. But one of the best ways of cooling down is sleep. All right. I see a lot of the basketball players, and we used to do this, right? We
Yeah.
used to, after the game, if we won a game, what was the next best thing for us to do? We went out, started
Yeah.
drinking alcohol.
Yeah.
We stayed up
Party till
on
the wheels fall off.
party, party nonstop, right?
Yes.
we the alcohol in itself increases the levels of inflammation in our system. All right. So if
Yes.
I would advise players that whenever you have tournaments, after the game, if there's nothing else to do, the next best thing for you guys to do is rest and sleep. Rest and sleep. All right. Because when you're sleeping is when the body regenerates and heals some of the tissues that ruptured, got torn, or uh, any form of laying down of structures. The new structures happen during that period of sleep and rest. So that is very important. All right. And if you have more than enough players in the team, the best thing the coach can do for that team is alternate players. All right. Don't have the A guy play 90 minutes straight. Right.
Hata watu wa bench wachezi.
Yeah, umekalisha tu mtu kwa bench juu you have a feeling that if so and so is not playing for 90 minutes, then you will not achieve your scores as a team. But
Yeah.
coaches also need to understand that these players need to be rested, and they will perform at a higher level of efficiency when they have had enough rest. So rest is very key for healing. And you can
Yeah.
use ice, you can use heat to reduce any form of inflammation.
Yeah. Yeah, I remember sometimes we used to play when I was playing professional. We would play back-to-back games like today and tomorrow. And
Yeah,
I remember we would finish a game and we would have to go back on the court and like run easy runs, like jog for like 15 to 20 minutes before we'd go back to the locker room and change and take a shower to go back to the whatever we were. But if we had a game the next day, we would normally go out after the game is over and would run for like 10 to 15 minutes, easy running and stretching before So I know there's a lot of education out there, resources, but we are not just tapped into those resources. We have someone like you, we don't tap into that resource. But so, um, is there a place where like players in Kenya can find information like you guys? Do you have like websites where players can find or what's the easiest? Sometimes you get on Google and you get really lost because
yeah.
there's so much information to discern it. It's sometimes it's like wow, you can't even figure it out. Is there like some people in Kenya or some in your field the players can follow on social media on so we can be learning and seeing what's the new trend, what are you guys doing if you get an injury, this is what you can do.
That's a very good question. I would say I don't have an answer for that yet, but I guess I what I can do is I follow a couple of people on social media who are really good at either their strength and conditioning coaches, and or their performance sports and performance coaches who are
Yes.
doing a great job in terms of putting out education on there. But there is
Yeah.
not one particular website that you can go to. And if the basketball association has a website, we can offer our time to put that information out there. But there's a lot of information, there's a lot of websites that if you so Kenyans spend a lot of time on social media. The problem with Kenyans is they spend a lot of time looking for information that does not really help them. If I
Yes.
was an athlete, if I'm playing basketball, I will look out for number one, who's the best basketball player out there. Does he have a training routine I could look at up to? Like when I was playing, I used to look up to Kobe. Like I wanted to play like him. I wanted to move like him. I wanted to think like him. So watching him was the next thing. Then I'll go on and see, what do I do for an ankle sprain? What do I do for knee pain? What do I do for back pain? All right, and then I'll go on to certain pages, and I would say, if you're looking for information that is medical information or medically oriented, try and see if that is information is from a medical institution. Is the website from a medical institution? If it's from a medical institution, then you're highly likely to get the right information. If it's Wikipedia has got a lot of, it's everything, everywhere,
Yeah.
all over the
Yeah.
place. But there are articles as well. If it's out of an article, and you can see it's a highly quoted article, then that has got also a lot of information. But if you're looking for any form of medical information, ensure that it is out of a health institution, and they'll always indicate there that this is from a particular health institution. But I would say, reach out to us, ask questions, because asking questions, you can always reach out uh, to any physiotherapist out there that you see and ask them questions. And I will also say, I want to advise the players, ask hard questions. Ask whoever you're seeing hard questions. If you go to the doctor, ask questions. Why are you giving me this drug instead of this one? All right. Or I read somewhere, because an educated patient is an empowered patient and is technically halfway treated, right? Like
Yeah.
diabetes. Diabetes used to kill people back in the older days because people had no information whatsoever on how to address it. Nowadays, we have people with diabetes doing amazing stuff in, all over the space, basketball, football, all over, because they have information on how to manage their condition. So, what I can advise, and this is something we can all start to think about, is let's have a website for the Kenya Basketball Association of Federation, and then in that website we can volunteer our time to provide information in relation to, hey, these are the number one injuries that happen in basketball. This is the process or the routine that you can use to prevent it. All right. So I'm more than willing to do that, and help out in that direction. But
Man,
what I can
I'm gonna
do
take you
is,
up on that one.
yeah, with your help, is we can get some of the people who already are, doing a good job on social media in terms of educating people, and then we make a list of those people, and then we can send it out to basketball players and where to find them.
Man, I'll take you up on that one. Obviously there's people like Ndela, she's a fitness trainer. She's very vested in, she's been doing a very good job even helping players
Yeah.
get get their potential. But I know this a guy asked you a question about water. Does taking water during practice or after practice or during play help reduce the risk of injuries? Unajua Kenya kunywa maji kwa mazoezi unaambiwa ni maji ni weakness. Drinking water in practice is a sign of weakness.
um Hydration is key, as in if
Yeah,
you drink
yeah,
a lot of water, it doesn't really prevent you from getting injuries.
Yes.
I guess the best way it will help you prevent injuries is, you'll need to go pee a lot of times. So there is very less contact, but there is no relationship between, unless you're training in high altitudes where there's a lot of, or there's a lot of heat. If you're playing in Dubai and you're not well hydrated,
Yeah.
then
Yeah.
that will lead to problems, right?
Yes.
Um, but if you're playing in Kenya, just hydration is key. I'm not saying that drinking water is not it's not mandatory. You drink as much as you need, but drinking water is not a form of injury prevention. No, it's not.
Yeah. Yeah. You know, again, it's 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 the perception of like how we do things that sometimes things like that come across. It's just the perception of how we do things during practice. There was a time even in Kenyan practice players did not drink water because there was no water breaks. And it's taken us some time to get to where now coaches are like, hey, let's take a water break because before we never it was you could not be seen drinking water. You're tired.
Sign of weakness.
Why you need water? You're tired, man. And you can't show coach you're tired.
Yeah, if you feel like your body is too hot, or getting too heated up, you drink water because that cools down the system, right? But
Yeah.
drinking water is not. I don't. It's not listed anywhere in the research as a form of injury prevention. No.
One thing you would wish all players did and they don't do. What is that?
Ah, well, number one is
Sorry?
uh uh you rest. Number one is rest. Number two is strength training. And number three is balance. But the number one at the top of the list is, if you're an athlete, you need to have enough time for rest. All right. And especially during the peak times, or rather during the game times, it's important and paramount that you have some good form of rest. Also, and a lot of athletes feel that they're already strong, right? Because of the virtue that they play, and they're playing long hours, right? But strength training is paramount for all athletes. Okay, so and strength is not you being having the ability to play, uh, 90 minutes without getting tired, or you're used to it, or without running out of gas. Strength is having a proper strength training program for your foot and ankle, your hip and knees, because a lot of the basketball players, if you look at a lot of the energy that we spend or we use, comes from the lower extremity. So a good strength training for your hip, knees, the glutes is important. And number two is balance training, right? So a lot of the balance training, people don't do balance trainings, but balance trainings are the best exercises for foot and ankle recovery. And if you're looking at ankle injury prevention, then we need to do exercises targeted towards the foot and ankle. And they're simple exercises, all right? So simple is also less is more. That's what I want to say. Less is more to all the athletes that are out there. Less is more. So that's
Yeah.
what I can say to them.
Because I remember here when you play here, you either have to have your ankles tight. Excuse me. Either have to have your ankles tight or you're in ankle strengthening conditioning program that you do throughout the year, and then you don't get tight. That was one of the options some of coaches were giving some players. So again, one last question here we're going to take. He asking, how does one handle persistent migraines during training or game time as a player?
Oh, migraines. Wow, that's a um I would ask a couple of questions in relation to that, because is it, do they have migraines? Is it headaches, or is it migraine as
Yeah.
a pathology? So I don't have the best answer for that unless I ask a lot more questions in relation to whoever asked that question.
We'll follow up with him offline. We'll follow up with TJ. TJ, we'll follow up with you.
Yeah, I have a couple of questions to ask in relation to
Yeah. We'll
why will
follow
you
up
be
with you,
having,
TJ.
yeah, why would you be having headaches while you're playing game?
Man, Zico says he needs something from you, man. Zico said he needs something. He got to take a nugget from you. He got to take a nugget from you. Yeah,
There's
he's
another
trying to get
question.
back. He's trying to get back in the groove playing, man. He's trying to get back in good shape.
All right, I recently got runner's heel and had to break my running and playing routine for 2 months in. I've been doing stretches and lots of rest, but I feel it's healing too slow. Any key advice? Well, healings take time.
Yeah, I told you, we got to
Healing
get
takes
back.
time. All right. So, Kadir, tendons are like, you know, they don't like a change of routine that is too quick.
Yes.
Tendons like a slow and steady increase of load. A lot of the times we get tendon injuries because we did or introduced a training that is above the level of the capacity we were in a little too earlier. Okay, so I would say, take your time to heal, because if you rush things, that it won't go away. All right, so healing takes time, and it takes patience, and it takes very simple exercises as well to do for you to heal. They don't have to be complicated exercises. All right. So my best advice is, let the body take its natural course to heal, and yeah, keep doing what you need to do, because ideally it takes up to 6 months for tendons to heal completely if they had a tear or if they had a rupture. So
Yeah,
go
I played
slow.
with Achilles tendonitis for a whole season, so I know how you play. You feel good today. You think you're back, and then again you play a game and it's back to where you are before. You take 3 days off or a week off. You feel good, and you come back. So it took me resting for almost like 3 months for me to be able even just to heal. So I understand those tendons. Then it's crazy. You can feel better today, but then you step on the floor and it's back to where back to. But so if I want to follow you, man, where are you? Where are you on social media? You on Twitter, Instagram, Facebook? How can we follow you, and how can we, keep in touch with if someone wants to follow you and see what you do, where to find you, etc. What social media do you use?
All right. I'm on Instagram as the Kenyan Physio. I'm on Twitter as the Kenyan Physio as well. Or at Ongwen Martin. I'm on Facebook as Machiavelli, Luciano Martin. Yeah, Machiavelli, the Italian Prince, Tupac, all that stuff.
Yeah, but
Yeah, and yeah, you can shoot out any questions that you have. We have a clinic in Westlands, called Afia Africa Orthopedic Services. So we don't only do sports stuff. We do, we treat all-rounded musculoskeletal problems, from back pain, neck pain, um, hip pain, cardiac issues. If you have had problems, we can address that. If you've had a stroke, we treat that. Pediatric issues. So find me on Twitter as at Ongwen Martin, and on Instagram as the Kenyan Physio. A lot of it is, if you just type in the Kenyan Physio, you'll find me there.
what's the name of the clinic again in Westlands?
Afia Africa Orthopedic Services.
Yeah, we can't get off without first of all. Let's talk about your give back and what you're doing, Machinani. We gotta talk about that before we get off. Man. I love what you do, but that's the icing on the cake right there. whatever you do, you go back and you do these things for in your community for free, and you help people. Let's talk about that and about that.
Yeah, so Afya Bora Mashinani is an initiative we started roughly 5 years ago, where we go into rural villages to number one, treat people who have musculoskeletal conditions, and we triage them. So sometimes we find people having cancer, yet they didn't know that they had cancer. So we try and kind of like bridge the gap between them seeing so this person and this person, yet they don't have an answer to what's going on. So we triage, we help them triage and have the quickest pathway to treatment. And then we do education. So we educate people on preventative measures for a lot of the non-communicable diseases. So if we're not careful in the next 7 years or 5 years, we will have a very big rise in non-communicable diseases in Africa in general, because of advancements in technology. People moving less like we used to. So
Yes.
we focus on educating the masses on these are some of the simple things that you can do to prevent you from seeing a doctor or seeking medical health care. And also we treat them that if you see certain symptoms, these symptoms warrants you to seek medical attention sooner than you think. So that's what we do. We do it all over the place. We did it out of passion and love for the profession, but also love for the Kenyan people. We've been doing it without funding, but a lot of people are reaching out to for us to make it a little bigger than we do it at the moment.
Yeah.
So we are in the process of yeah, if we find the right stakeholders, as I mentioned, funding in Kenya is
You
you need
never
to know
know.
somebody. You
So
need to know. Yeah,
my wife is a nurse, and she's asking. Here's a question she's asking:
yeah.
what are the challenges you experience in the rural areas? I think that's
Well,
coming from a place of her wanting to know what she can help.
yeah.
Again,
So
I'm just throwing this out there.
yeah. Well, number one is there is not enough specialized medical professionals in those areas. First of all, you have areas that don't even have clinics. They don't have a proper healthcare center where they can seek medical attention, right? Number two is they don't have the money for, treating themselves if they have a serious condition that's going on. So a lot of people, if you go to the rural areas, they will rather stay in pain, and a lot of times they'll only seek medical attention if that pain is stopping them from moving or doing something that they have actually been doing. So you find that there is no access. There is no access to a proper medical facility. There is no access to specialists like us. A lot of the rural areas, they don't have an idea what physiotherapy is or what a physiotherapist does. So those are some of the challenges that we have. Even getting there is a problem.
Yeah.
Poor infrastructure. So those are some of the challenges that we have. But it's a ton. It's the list is long. You know.
Yeah. So right now, currently in Kenya, is there any medical insurance that covers your services? Let's say a team can afford insurance. Is there any a medical cover they can get that they can use that will cover like physio or without a referral, let's say for instance, or is there something like that out there?
In our clinic, we still don't have insurances that help in covering medical expenses for our customers. But there are institutions that you can go seek physios or seek physio care that already have insurance. So depending on the insurance cover that your team has, then you can go to select places. And I can make a list of some of the physios I know who work in these institutions because we train them. We do continuous medical education for physios. So we've trained physios at the Aga Khan, we've trained physios at Nairobi Hospital, physios all over Kenya, in Tanzania as
Yeah.
well, and Uganda. So I have a list of some of the physios that if you have certain insurance covers, you can go to their clinics. But us
Okay.
guys, it's cash. We've tried to reach out to different insurance companies, and they're taking their sweet time. Of course, you know how the system works.
Yeah, yeah,
So,
yeah. New guy. New guy. You can't eat. You're the new guy.
but yeah, but if we are working on getting enlisted with insurance companies, and once that's up and ready, then it'll be easier to seek medical attention from us. But we do write very detailed clinical reports that you can go claim your money. But most of the insurance companies, of course, they bully clients. They say no, you need to
That
go
doesn't
to this
qualify.
clinic and that clinic. But yeah.
Yes. So one more question. One more question here. Again, this will come from what basic equipment do you lack? So if someone was to send you a care package, what would that
Mhm.
look like for you?
In our clinic.
No, in terms of what you do, in terms of what you do,
Oh wow.
equipment, like in terms of what you do, like your clinic, your day-to-day life when you're helping other people.
Well, if it comes to sport, I can write a whole list of some of the things we need to kind of like come up with a full blown serious sports clinic,
Yeah.
which we don't have. We don't have a serious sports clinic in Kenya
Okay.
at the moment. So if whoever is asking, I have a list I can send you. I can
Just
give
send
you
to
a
me.
design of how we need that to look like, and then we can work from there.
All
But
right, send you my WhatsApp, man. Send you my WhatsApp. We can see what we can do, man. We can see what we can do. Hey,
yeah, all right.
man, but it's been fun, Martin. It's been real fun, and thank you. I know you are busy. You had engagements today. You're a busy guy, but I appreciate you from for taking your time to do this today. And there's some things you've mentioned. I will take you up on the tips. We can come up with a tip Tuesday or something like that moving
Yeah,
forward, and we can share basic videos of I don't know,
yeah,
a minute
that's
videos or
it.
something like that. We can do that. So we'll look into that, and I'll be reaching out to you to get your assistance with that.
Yeah, all right. Yeah, and I think we can reach out to NBA. I can see that I've seen a lot of the NBA Africa starting to gain some traction in the space. And yeah, we can send out proposals on how we can work together with them to run projects that are not just basketball oriented, but we can talk to um, the basketball players to be champions for prevention of non-communicable diseases. Talking about mental health and how basketball has helped. Kind of like put them in a safe mental health space. There is so much we can do, and I guess it just needs the right people in the right rooms at the right time.
Yeah, I mean,
And
you gotta speak
there's
the same.
and
You gotta
yeah,
speak the same language. Also, you gotta be on the same page. It's just tough when you have different people. As I said, when you have a coach, there's a trainer, there's a strength conditioning, and if those things don't align, because at the end of the day, the coach wants that player to play. But
yeah,
that's the only reason the coach wants their players to play. So if they don't fall in, and that's even the trap a lot of trainers, personal trainers get in trouble with coaches because
yeah,
they do not follow what the coach expectations are. So, man, I appreciate you sharing your insight with us today, man.
yeah. Thanks for having me too. I appreciate that as well. So,
Thanks, man. I'm gonna talk to you offline. Appreciate you.
all right. Thanks.
Thank you.
Cheers. Bye.
Cheers. There you had it. Great conversation. Great conversation. The Kenyan physio, Martin. And if there's anything you learned today, he said, if there's one thing, you don't have anything else, but there's one thing you can do. He said that's rest. After finishing your game, get your rest on. Get some rest. Get some rest. But until next time, everybody stay safe. Be blessed. That's my time.